Hello, everybody. I present myself. I'm Professor Christian Durig. I live in Melbourne, Australia, and I came to Lucknow for a conference on drug discovery for various diseases. I personally work on malaria and try to find new drugs against malaria. So I came to Lucknow, gave my talk, and after that, I started to experience severe pain when trying to urinate. I finally completely stopped being able to urinate. So I had a doctor of the institute come to see me. They said, "You really need a catheter." And so they introduced the catheter to my bladder there at the hotel near the institute. And they said, "You must go to the hospital. So we'll try to find the best hospital possible." And so they brought me here. And I think that was a very good choice. I actually, this was quite an unpleasant experience, medically speaking, because, having this catheter and it's not pleasant. First time it happened to me. But I was first brought to the intensive care unit here at the hospital. And I immediately noticed that I was in safe hands. So I had very, the team of doctors really elicited huge confidence. They knew what they were doing. And the nursing staff there, I remember one particular nurse called Amit, who really went beyond his duties to actually make me feel good and safe and everything. So that was really, really nice. Then they removed this catheter. I tried to pee. I only could issue some blood, and so they had to put a second catheter to me. I stayed another while at the unit there, and the intensive care unit. And when it seems I had stabilized, I was brought up to the normal general ward for the urology department. And I was greeted there by Ankil, who is the manager of this floor, and who welcomed me, make me explain to me how things work. And then the nursing team started to take care of me. And I'm unfortunately forgotten all their names because there were several shifts. I was there for quite a few days, but they all were really, really lovely, very, very attentive, attentionate, and I actually congratulated the people who delivered the food. The food was always very good. I'm afraid to say that the kitchen went beyond their duty as well to actually give me some food that they knew I would enjoy, like Western food. And it was very good every time. Breakfast was nice. I had omelets, fruit, yogurt, cereal, bread. I had a succession of delicious meals while I was here. And all in between bouts of seeing the doctors. Every day I saw the doctors. We talked about how things were going. So overall, it was a really, really lovely stay. Actually, I even talked to the head of the nursing department, the nursing team, and I was amazed to hear that she's in charge of 1.2 thousand nurses at this hospital. It's a big place, and I congratulate her on the fact that all the nurses I had to interact with were very capable, very attentionate, and so it was a very good experience overall. So to summarize, it started badly because it's an unpleasant thing to have this kind of urinary problems. But overall, the information I got from the doctors, the care I got from the doctor, the accompaniment I had from the floor manager Ankil. And all this extends to the entire personnel, a person who's involved in actually, the clinic duties and everything, called Nendu. He's such a nice guy, and he took me for a walk around the hospital and everything. So I am very, very grateful to everybody in this hospital, and I hope all the relevant heads of departments and heads of teams will trickle down this feedback to the people who took care of me, because I am very, very grateful. I had a bit of anxiety before boarding. I'm boarding my plane tonight, first to Delhi and then a very long flight to Melbourne. But I will be equipped with all I need. The catheter, a new kind of bag that I could hook to my leg, and I received the detailed list of all the medication I need to take and how and when, and I will have a very comprehensive report I can give to my medical team in Australia. So honestly, it couldn't be better on both the medical side and the care side. So I am very grateful to everybody in this hospital. And, if this is listened to by somebody who actually has to come to this hospital to have some problem solved, don't worry, you will be taken care of very well.
Hello, my name is Dr. Rohit Kapoor. I am a consultant in the Department of Urology, Robotics and Renal Transplant at Medanta Hospital, Lucknow. So this patient presented to us in the emergency with complaints of lower abdominal pain and acute sudden retention of urine. So once the patient came to us, he was evaluated and he was found to be having retained urine of about 300 ml on ultrasound. So patient was decided to be catheterized immediately. He also had some component of infection for which he was admitted under us and was treated with intravenous injections, antibiotics. Patient got significant relief. His reports showed improvement. Patient was given a catheter-free trial, but unfortunately could not pass urine. And having had similar complaints in the past, patient was decided to undergo surgery, TURP. But due to his nationality constraints and his time constraints, patient decided to go back to his native country, Australia, where he would now undergo further treatment. Patient was really happy with his improvement and in his symptoms, and we are in touch, and the patient is now happily back and is getting his proper treatment done. Thank you.